And my happiest day was the day with all my team. I put the Teos, I finished the surgery, and we said, that's it. That's the answer that we are looking for. I don't know how many, for a decade. That I couldn't sleep for 3 days.
Gentlemen, welcome to another episode of the Rhinoplasty podcast with me, Dr. Cameron McIntosh. It's such a pleasure to have you guys from all around the world listening to our weekly podcast. This is season 2. We're in the month of June, which is proudly brought to us by Vectra from Canfield Scientific. Vectra makes this really amazing 3D camera system for us to morph pictures, etc. So the month I've called it the Evolvers, and there's some really interesting guests we've had on the show, and really why have I called the Evolvers? These are guys who've been in the game for a while, but they keep being on top of their game. And today we have the honor and privilege of having a guest all the way from Istanbul in Turkey, none other than Doğan. Teo, welcome to today's show.
Thank you very much. I'm so happy to be here.
So, Teo, it's so interesting to be able to spend some time chatting to you. My first question to you is, how did you get involved with where you're at now, being one of the foremost teachers of rhinoplasties? How did you get into plastic surgery? Just tell us a little bit about your story.
Yeah, I have a story why I'm a plastic surgeon, and the story starts in South Africa. Actually, and I was 11. I had an accident, and I passed my hand from the window because we were running something, and the window came on my face. I put my hand something like this. There was a big crash, blood everywhere. I remember my radial artery, I saw the arterial flow in my hand.
Wow.
And this night we were in the middle of nowhere in South Turkey somewhere, and there was this general surgeon who operated me. Well, I was operated twice that night, but finally, a general surgeon, after hours, he operated me. He had no idea about sand surgery. We are talking about 1979, and the guy, he sutured my ulnar nerve to a tendon, and on the other way, it's reverse, and all tendons somewhere, and blah blah blah. And then my hands became infected. I remember the pus coming from my hands, stuff like this. And then in Istanbul, then after months, I've been operated by a plastic surgeon who was trained in South Africa, Dr. Fethi Orak, and he was an excellent hand surgeon. He was a plastic surgeon and hand surgeon, microsurgeon. For these years, that was something very unusual. And he operated me again after 6 months. In a year, I had 2 more operations by him. And, I had ulnar nerve injury. I had all my tendons cut in my right hand. And you can still see,
Wow.
I'm almost a little bit crippled. Yeah. I have tendon transfers on my right hand. And all this knowledge came from South Africa. He was trained there. And now, my hand works, but I'm not 100% like other hand.
Well, imagine you were at a 100%, what it'd be like, because you do pretty amazing stuff with what your hands are at the moment. Okay, so I'm going to ask you some hard questions, okay? I don't want you to feel uncomfortable about this. So the first question, if you look at your Instagram stuff, everything is Teo. Why Teo? Is this about you, or why do you want to do this the whole time?
Yeah, I know. We are, as surgeons, especially aesthetic surgeons, we are all a little bit narcissistic. That's cool. I mean, we have to accept it. We are here. We are doing this job. This is a crazy job because we all have a little bit of narcissistic traits. That's good. That's going to help us in our job. But the problem starts when you have narcissistic personality disorders. Then there's a problem. But of course, I'm a little bit narcissistic. Most of us, I can say. But the true reason why I name everything Teo, my technique, my instruments, my suture, I don't know, my graft, everything Teo, 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 Teo. The reason is not really exactly like I'm a narcissistic. The true reason is, in my past experience, I learned that if I don't really name something, then somebody else will name it. But it's not going to be my name, but it is going to be his name. I lost so many ideas of mine in my past that at one point one day I said, now I will name everything my name. That's the end. I will never give any idea to anybody else.
No, but that's cool.
So I'm sorry for naming it. Yeah.
No, you don't have to apologize. No, by no means. So, I mean, I know that you run lots of courses and stuff, and the criticism has been leveled to you to say, oh, it's cool just to be this doctor who does work on courses and education, but in the real world, you're not actually operating. What's your response to critics like that?
I'm not very active like many other surgeons because I don't work so much. I work like maybe 8 months a year. 4 months, even more. I'm off. I windsurf. And when I work, I will work like maybe maximum of 3 days a week. I will not work 5 days, 7 days. So I rarely work. I'm mostly either windsurfing, traveling, doing nothing, spending sometimes. So now most of the work I do is going to be in my educational courses. Like I have fellows, then I will do 4 days of fellowship. I do now almost like weekly. I do this. I have 5 fellows, 4 days. I take them. We start in the morning, course every day. I talk. Then we go together to the operating theater. I operate. Then we go having a drink somewhere and talk again. 4 days is full. Then I work. Then I will do 4 surgeries, full day. Or I have a cadaver course. It's going to be like 3 days. Again, I will talk. And then we go to the cadaver lab last day. It's a full day. It's a real work.
So a question. So
private patients...
Sorry,
are rare. Yeah.
I just want to ask you one question before we go further on the courses themselves. I mean, we have listeners from like 70 countries around the world listening to the show. How can they actually get hold of either to try and attend one of your courses or if you offer virtual courses?
I don't like the virtual courses. I try to be like, I think it's surgery. I mean, it's medicine. We have to be in face to face. I have to touch the guy, and the guys must see and touch me, and ask me directly his questions by seeing this. This is the best way. I try to do everything in real life. So what I do, I have fellow courses and I have cadaver courses, and I'm gonna have in June. I'm gonna have a real big, like a congress, I can say, in Hilton Hotel. And there will be live surgeries. I will do 4 live surgeries, and I will talk about my course and everything in 2 weeks' time. So, but other than this, really, I have my book, and I try to show a little bit of what I do in Instagram as well about technique.
Yeah. And Teo, in terms of just like your private practice where you're not teaching, how big is that, where you're actually just operating on patients that come and see you and get operated by you?
Yeah, I will, of course, accept some patients for operation, but most of the patients I operate now are going to be in my courses.
Brilliant.
So, yeah, so it was a dream for me to really operate the patients that choose. I'm going to operate this patient, not because of the deformity, but because of the mostly like psychology. So in private practice was always a little bit hard for me. Now I feel a little bit free for this.
Okay. So
I operate a lot, but always with my fellows. So in the program.
So when are you going to come and do a Turkish Rhinoplasty course here at Edge Day Hospital in South Africa?
Anytime you guys invite me, I would love to come to South Africa. I have a relation in my heart with South Africa.
And your hands, because that's the guy who fixed your hands.
Yeah, that's
No,
why
we'll make
I
a plan.
have
So I'll just even give a shout out, listeners. Watch, keep an eye on this. We're going to have a course in South Africa for sure. Okay, another question. So this is a bit of a controversial one as well. Apparently, and I don't know if this is a joke or not, you've said that you can do the same steps in a rhinoplasty and solve all problems in all cases.
So what's wrong with it? Tell me. Yeah, I know, I understand. Because the general teaching says there are many deformities, and for each deformities, there are many solutions. So a surgeon armamentarium must be large, and you have to know all of them, and you have to choose according to patients. Well, that sounds logic. I understand. And I believe this for many, many years. But after some experience, I realized, in fact, I always do the same. I see my friends, they are always doing actually the same thing. But, then they will change the technique from one patient to another. But I never understand the real indication for it. One technique will work actually for all the deformities and the other one. For my case, for what I did, at the end of most surgery, if you ask me, Theo, have you done a dip projection or projection or deprojection, rotation or derotation during this operation? At the end of surgery, sometimes I cannot tell you exactly what I did. I have to see the photo before and after, and I can say, yeah, this is a deprojection, or I projected. Because I don't care. At the end, in my technique, I'm going to have the Teos thread, and I'm going to put my tip on the Teos thread somewhere. If I Teos thread, I put it that way, it's going to be deprojection, that way, projection, rotation, and derotation. Or projection, I will put my tip on the tip of the graft, and it's going to be projection, or down, and it's going to be deprojection. What I do in the operation, I try to see what I do. And I try to make something that I like myself. I say, oh, it's good. Then I stop there. I don't care if this is the projection or projection. That's why I always do the same thing at the end. But the result is going to be different. You understand?
So the question is, are you more inclined to want to see what you feel is the best for that patient? Or if the patient comes and they are asking a result that you don't like, would you then not operate on that patient? Or how do you try and make that work?
Yeah. I at the end, I learned with my experience. If at the end of surgery, if I don't like what I did, no matter what patient asks me to do, at the end, he or she, the patient, and nobody else will like it. That's my rule. When at the end of surgery, I must be very happy of what I did. I must say, yeah, it's a good surgery. I'm the man. I did it. Blah, blah, blah. Then everybody likes it. If not, if she says, I don't want projection, keep it down, hump, don't touch my hump, something like this. And I can guarantee at the end, she's not going to be happy. And she's going to say, why did you do this? But I said, but you told me to do that. And anything said before will be forgotten after surgery. So if somebody says something like this, I said, not me, go to someone else. If you are going to be operated by me, please leave me alone in my decisions. Just check my Instagram. If you like what I did, then I'm going to do something like this, but I don't know what I'm going to do. But I'm going to do my best for you, and I'm going to do something that at the end, I will be very happy of it. That's all I can say.
That's cool.
Are you in? I do it. You are not?
Okay. So tell us about the worst day of rhinoplasty in your history. And then you tell me what the best day of rhinoplasty was for you.
Worst day of rhinoplasty will be probably after years of experience. And the end of rhinoplasty that I know that the tip will fall. Because there was a point in my career that no matter what I did, at the end, I always lost some projection. And loss of projection is not only a diameter a measurement that you lose, but all the tip will collapse and you lose everything on the tip. And tip is the beauty of rhinoplasty. So I had it many, many times. That each time I knew that I'm going to lose it. That's why I started this Teos strat thing, so that I will never lose my projection again. And my happiest day was the day with all my team. I put the Teos strat, I finished the surgery, and we said, that's it. That's the answer that we are looking for. I don't know how many, for a decade. That I couldn't sleep for 3 days. And no, that's true. And that graft, I knew it for maybe 15 years. It was not the first time I was using it. I was only using it in my secondary cases, very difficult cases, things like that. I don't know why I delayed it so much. It was a revision of mine. I did it. I said, I'm so stupid not using it since today in my all cases.
But now the cool thing about it is it's taking you so long to learn that, but you just are sharing your knowledge, which is really wonderful. So I have another question. In the last, say, 10 or 20 years, Turkey has just grown as the rhinoplasty place to go. So the two questions around this is why, but then within that space, obviously there's a lot of guys who you're world famous on your own website, So yet there's a handful of surgeons in Turkey who are really, really good. So I have two parts. What caused Turkey to become so good and the main place for rhinoplasty in the world? And secondly, what's the difference between the really top guys and the guys who are not quite as good in Turkey?
First of all, about the story of Turkey is it's all about social media. Because what we do is this aesthetic surgery part, the rhinoplasty, is something that you need nothing. You need just few instruments, a good nurse, a good anesthesiologist, and you do the job. And if you can show what I did freely, if you are free in your job, a Turkish guy head starts to work. Freedom is very important. And if I can show the world what I do without any, filters, think about 15 years ago. I'm a good surgeon, but you will never know my name.
Yeah.
Whatever I do, because I will go to the guy. I will say, "Can I present in your you are doing the congress?" I will say, "Can I present?" The guy will say, "Are you talking to me?
Yeah.
Who are you? Get out of here. You are not from my team."
Yes.
You understand what I mean?
Yes.
But now it's finished. These guys they dissolve, they disappear. Now I do something, and you see me, and I can see you. That's why Turkish plastic surgery exploded a lot. Also, on the world, there are many surgeons that normally you will never know my name. Yeah, that's the
okay. And then the second question, in
surgery.
terms of guys like yourself and Gökçel and Barış and Fazal and these guys who've really made a name for themselves, what do you think kind of has set those kind of guys apart from most of the facial plastic surgeons in Turkey?
Yeah, I think there are, especially the young generation, they're so good. I mean, I can tell you, there are many guys now around me. They always followed me. They are very, very good. They just learn my technique. And I can tell you, these guys, they are better than me now. They are doing the job, my technique, better than I can do. They are so good. I mean, their results, excellent results. You can see them on the Instagram. Just follow the hashtag Rhinoplasty, Teos, something like this. You will see these guys are excellent surgeons. But they are not now so popular. Maybe this is also a little bit of how to use the social media, a little bit of your age maybe. But there's a generation coming very strongly in Turkey.
So let's imagine there's some patients listening on the podcast, and they are searching to try and find a good rhinoplasty surgeon. What are some of the tips that you would want to tell somebody when they're searching for someone who is trustworthy, who will help them, and who will be with them for if things go wrong, complications? But let me just be quiet. Tell me, if I'm a patient, I want to know who's a good rhinoplasty surgeon. What's your advice?
I think choosing a doctor for anything It's very difficult. Even when I choose a doctor, I have difficulties. It's something very personal. If we are talking about aesthetic surgery, and especially we are talking about rhinoplasty, it's something very, very, very personal. But what I can say, I will definitely go to Instagram. I will definitely look to the past, what this guy had it. I will definitely try to see the personality behind. I think this is very important. A good surgeon, it's not only a good result, but it's a, how can I say, it's a personality, it's a way of presenting himself, it's a way of behaviors. Something that you can smell, not always see. I will check for this. I will check the good surgeon, good doctor, good human, and good results, of course. And I will look for the style. Also, style differs between patients. And anything that I will feel like insincere, like a little bit marketing, I will stay away. I think this is very important to be open.
No, that's great. I think it's important. And I want to come back to one of those points just now. But if I were to ask you now on the first part if you look back over the last 20 years of rhinoplasty around the world, what are some of the big tickets that have stood out for you that have happened in the last 20 years that you think have been major milestones in rhinoplasty?
Yeah. This I will say the same thing. I think rhinoplasty about 20 years ago, for a long time, stopped its progress. Yeah, like I said, like for years, we stayed in the same point. There was no progress at all. And the reason was, like I told you, some groups control some congress, and the congress and journals are the only way that one surgeon will be aware of another surgeon, another technique, another way of thinking. So our vision started to get really narrow, and everybody started to believe the same things. Like this works and this doesn't work. You can say this, but you cannot say this. This is it, but not this. So we need to be a little bit open in our minds to get in some progress. And you don't see anybody else but the same guys. And the same guys always say the same things, the same slides, the same patients that I see in all congress. And for a while, I stopped going to any congress. I said, I will stop it. Because each time I go to a congress, I have a lot to say. I can't. I come back. For 3 days, I'm so depressed. I said, I will stop it. And believe me, that helped me a lot. But now it changed. After social media for all around the world, I think social media helped a lot to awake the people. Like awakening. It was a ring that everybody said, yeah, okay, of course there's a knowledge. There's something that we learned, we know, but let's think again. Let's leave it open. Let's try different things. And rhinoplasty is a very interesting subject. So there are a lot to talk on it.
So, okay. I mean, that's fascinating. I think it does have it's opened the platforms, especially over the last 2 years with COVID and now having all these kind of virtual conferences, et cetera, et cetera. So looking into the future, where do you think rhinoplasty is going in the next 20 years?
You are not going to be happy of what I will say. I think for the short term, rhinoplasty is going to be much better. I think now we solved the problem. We know what is going on in the noise, and we know now how it works. I can tell you. But I think for the rhinoplasty itself, for the long term, let's say like 30 years, 40 years, 50 years, 100 years, and I think this surgery will be like our instruments will be in the museums, and people are going to come and in the museum they will say, "Oh my God, they were breaking the bones with this." Oh my God, they will say. They will love what we are doing now. There is no future of rhinoplasty, I believe. I think rhinoplasty is going to be quite technical with some instruments that will shape the bones and cartilage a little bit. And it's going to be something like, how can I say, like something like low class. If you have a noise job done in the society, you're going to say, okay, like it's like, I don't know, having boobs of 900 cc boobs, something like this. In the long term, because we created this demand. We created the demand of rhinoplasty, and people one day going to say, okay, I mean, it's nonsense, because it's going to be so easy, and everybody going to have rhinoplasty easily in 45 minutes. All noises will be done perfectly, all dimensions, and then there will be no meaning of doing this.
That's interesting, because it's not an easy operation. I mean, it takes years to become good at rhinoplasty. I think maybe you running all these courses is disseminating knowledge so that a lot more guys can operate a lot better than they do at the moment. Because I think one of the things that you speak about, that it used to be conferences, and if you're not in that inner circle, you can't present at a conference and etc. But I think it's also like that about not sharing knowledge in many ways, and where social media has changed that now, that you can go and share your knowledge. But previously it was just this elite group of people who had the ability and the knowledge to do that surgery well, you know?
True that. I mean, so that's why now the knowledge is exploding. Everybody can put something on it and all the world will see it immediately. If that works, everybody going to use it. If not, nobody going to use it. And that will give the development.
Okay, but now try and explain to me this. How do we try and be scientific about the knowledge and not just putting knowledge out there for the sake of in my hands? You know, how can we, that's the hard part, this wrestle between something that's actually scientific and works, and this is just the latest fad or opinion. I mean, let's really talk about this big elephant in the room, preservation rhinoplasty, something that was done more than 100 years ago. Eves have been pushing it for 20 years, and now in the last few years, suddenly it's the thing that everybody's doing. I'm very interested to know what your thoughts are on that.
Cameron, come on. Let's first accept that what we do is not science. We are not scientists. We are not artists. We are just technicians. Okay, in my opinion, you know. I don't know. My friends and my colleagues, they can take them for artists or big scientists. I'm not. You know, and that's why what our teaching, or I don't know, maybe even papers, scientific papers that we publish are not really scientific. We are talking about something that I do this and I like it. Do you like it? Good photo, then it's good. There is no science in it. We can't really measure. We can't really compare what we do. I read lots of articles about like very scientific, you know, with data and everything and graphs and everything, all about the tip. You know, shall we do this or this? If you ask me, you know, it means nothing to me. You know, I will just want to see the photo if that works. I see the photo, it works, I'm very curious about, and I want to learn it. Otherwise, you know, measurements, data, statistics, in our job, I don't think, well, yeah, we are not hematologists.
Yes.
Or, I don't know, something else. We don't deal with cancer.
Hematology was for me the most difficult subject in medicine.
Yeah, me too. So.
No, they're scientists. Hey, Teo, it's so interesting chatting to you. You know, you're kind of giving us a whole lot of left field stuff here, stuff that it's controversial, but it's good. You know, these are the things we need to talk about. So, yeah, I think we need to digest a lot of what you've said. Two last questions, like on a technical side. You know, like Vectra bringing us this, enabling this thing, this podcast at least. Tell me a little bit about 2D or 3D and morphing, etc. Do you use that much? Share a bit of the knowledge with the listeners.
Vector, I never used it because, you know, when I started, I really wanted to buy the Vector, but I didn't have money. So Vector, I know Vector is a very good system. So, you know, but now I stopped doing this, you know, pre or post-op for the patients. I'm too old. In my age, I think I can stop this. I said, Theo, now you can stop this. I just tell to my patients, look to the Instagram, I will do something like this. And if you like it, come, I do that. But I think Vector is a very good system, for sure. It was a dream for all of us when we started.
Okay, cool. So
then I used Photoshop for a while, then I stopped.
Okay, so I have two more kind of questions that I want to ask you. So there's listeners around the world. There's guys like in far-flung countries who don't have the exposure of being able to necessarily come on courses, etc. What would your advice to be for a guy who's really far away from being able to get help, but he really wants to make rhinoplasty the thing that he's known for? So what would your advice to be to somebody like that who's listening to the show?
Yeah, it's not always like you have to come and see the operation something. Of course, this is going to be a good way, or go to the cadaver, work with the surgeon, and it's going to show you. But we can learn a lot about ourselves by just reading the books. I think reading is still the main teaching method for all of us. And if you have the book, you read it, then you can do technique. Like my book, I wrote it so that somebody can read it about like in 2 hours. So you can read it again and again, and then it's very simple. I mean, do this, don't do this, I do this, pass the suture like this. Two photos, one drawing, and you're going to understand. I mean, as a surgeon, it's all these small manipulations that we can all actually do. There is nothing, like, it's not rocket science. And I think a good surgeon, I mean, an experienced surgeon, a good, well-trained surgeon, after like 2-3 years when he finishes training, by just reading books, watching some videos on the YouTube, which is also great now. We can watch many videos. A little bit doing his search on the Instagram, he can find his way and do his surgery. But I believe the most important thing in rhinoplasty is technique. It's not our hands. We don't have golden fingers. Like, I'm almost crippled. And it's something here that you have to understand the dynamic of what you are doing. And you must choose the best technique. You must choose the technique. Here, you make the difference of yourself. And then you use this technique properly, and I guarantee you're going to have a good result at the end. And in almost all your cases, let's say, not 100, but close to 100%, you can have very good results.
So coming back to your book, how do people get hold of that?
So it's a self-published book. So you can only buy in my website. It's teorhinoplasty.com, and just go there, and we're going to ship to everywhere on the earth.
Fantastic. Okay, guys, so make sure you go to teorhinoplasty.com and get the book, get instruments, learn about the courses. What an interesting man this is. Teos, so okay, you are passionate about rhinoplasty. You're an exceptional teacher. But what is that one thing that you love most about rhinoplasty?
Yeah, rhinoplasty is like rhinoplasty is different. I mean, I did lots of surgeries. I was trained for microsurgery, hand surgery, and then but at the end, I did lots of aesthetic surgery. I did facelift. I loved all the body workout, everything. But rhinoplasty is like I can say, I see this in all my friends as well. It's different. I mean, we all want to be good in rhinoplasty more than anything else. All plastic surgeons, all rhino surgeons, as far as I can see. So I don't know why. There's something psychological in rhinoplasty that attracts all of us. And so, yeah, I love this surgery a lot. And now I only do rhinoplasty. I stopped doing anything else. I did lots of facelifts and other stuff in the past. Now I refuse all patients. I only do primary rhinoplasty. No secondaries, nothing. Primary, proper rhinoplasty. That's all I do.
Yes. So, guys, there you have it, eh? What an interesting 35 minutes of chatting to one of the leaders of his field. Teo, thank you so much on behalf from myself, but also on behalf of all the listeners. And a shout out to Vector again for enabling today's episode. Guys, make sure you come back next week. We've got some really interesting other people lined up. So, Teo, thank you. May you have a fantastic year. And I hope you oversubscribe to your courses, and then you're going to have to come to South Africa and do one here.
Yes, I will. Thank you so much. It was great.